Hi everyone, I'm Dr. Elena Kalamantis, general dentist, and today I'm going to be sharing with you some oral health tips. It's always important to be taking great care of your teeth, making sure that they're healthy and safe from trauma, but these days it's especially important just because dentistry is a little bit limited in what we're able to do. We're treating true emergencies and essential services. So at this point, prevention is super duper important. Tip number 1, you want to be brushing twice a day at least. You want to have a soft toothbrush and you're going to go right to the gum line, angle 45 degrees, and in a gentle circular motion, you're going to brush your teeth. You don't want to be very aggressive at all because you can cause gum recession as well as toothbrush abrasion. Don't forget about the back sides of your teeth. Okay, a lot of times people will only focus on the front, but don't forget you have a top surface and also a back. So make sure you're getting all the surfaces. Tip number 2, floss, floss, floss. So whether you're using conventional floss or a water flosser, a Proxibrush, you want to make sure that you're using an interdental cleaning device at least once a day. And that's because if you don't, you're going to be missing 2 out of the 5 surfaces of your teeth. Tip number 3 is to watch out for the sugar and the acidity in your diet. Especially bad for your teeth are liquid sugars such as juice, pop, coffee with sugar. And what's really important is that you're not sipping these things throughout the day. That'll keep your mouth in an acidic state for much longer. Also bad for your teeth are the sticky sugars, such as chewy candies, caramels, and dried fruit. Also bad are the very hard sugars, like a candied covered nut. Not only can that possibly cause cavities, but you can also break your teeth on them, so you want to be really, really careful and maybe even avoid those things. Then there's also acidic foods and beverages that you want to watch out for. For example, lemon, grapefruit, all those things. In moderation is key because those can cause erosion of your teeth. Tip number 4, wear a night guard if you grind your teeth at night. Grinders are at a really high risk of damaging their teeth, so really important to be wearing a night guard. If you don't have one right now and your dentist is unable to make you one, be aware that you can just go to the drugstore and buy one over the counter. They're not custom made for your teeth, but you're able to heat them up and form them to your teeth, and right now it's definitely better than nothing. Tip number 5, don't use your teeth as tools. One of the most common dental emergencies that we see are broken teeth. A lot of times this happens when people use their teeth to open things. One that I hear way too often is opening beer bottles. Please don't do that. Also, some bad habits include chewing ice and biting your nails as well. Tip number 6, limit your consumption of alcohol. Not only do many alcoholic beverages contain a significant amount of sugar, but the alcohol itself can cause xerostomia, which is a dry mouth. Saliva is very much needed in your mouth to help flush away food and prevent cavities from forming, so a lack of it definitely puts you at a higher risk. Not only that, but xerostomia can also increase your risk of gingivitis as well as bad breath. Tip number 7, quit smoking. I think everyone is well aware that smoking is really, really bad for your overall health, but it's also really bad for your oral health. Smokers are at an increased risk for periodontal disease. This is where you lose bone structure around your teeth, and if left untreated, eventually the bone loss will progress to the point where your teeth become loose and need to come out, which is definitely not a good thing. Smokers are also at a much higher risk for oral cancer, which can be deadly. Tip number 8, wear your retainer. Right now, we're all out of our regular routine and it's really easy to forget about something like this. But make sure, if you want to prevent future relapse and future orthodontic treatment, if you have a retainer, you should be wearing it. Tip number 9, parents, this one is for you. Don't put your child to bed with a bottle. If you do, fill it with water. If it's filled with milk, your child would be at a higher risk for something called baby bottle tooth decay. This is where the milk is sitting on their teeth all night and they develop a mouthful of cavities. Also keep in mind that all the previously mentioned tips in this video are important for children as well. So ideally, they should be brushing twice a day, or you should be brushing their teeth for them twice a day. And if their teeth are touching, you should also be flossing them once a day. Well, that's it for my tips. I hope that you found them helpful. And if you ever have any questions, I'm always happy to answer them.